A question I hear constantly in consultation: facelift versus mini facelift. What's the difference and how do you know which one is right for you? And I want to start by saying something that might surprise you. The words mini facelift and facelift get used a lot online, but they don't always mean the same thing from one practice to another. So my goal today is to explain the concept clearly so you understand what each procedure is designed to do, what it can't do, and how to make the right decision based on your face. Let's start with what most people are actually noticing when they say they're thinking about a facelift. Usually it is not that they wake up one day and think, I need surgery. It's more gradual. They start to notice that their jawline isn't sharp as it used to be. They see early jowls, which is here, forming. They feel like the lower face looks heavier. They may notice deeper folds around the mouth, and some people notice that their neck is starting to look a little bit looser, or that their area under the chin looks less defined. These changes happen because facial aging isn't just about wrinkles. A big part of facial aging is descent, or lowering of the face. The tissues in the face slowly shift downward over time. The skin becomes looser, the support structures weaken, and the result is that the face can look heavier and less defined, especially in the lower third. So what's the difference between a mini facelift and a full facelift? A mini facelift is typically designed for someone who has early signs of aging, mostly concentrated in the lower face. The best mini facelift candidates usually have mild jowling, mild skin laxity, and relatively good neck definition. They're often patients who say, I don't want a dramatic change, I just want to look refreshed, or I want my jawline back, or I want to look like myself again. A mini facelift generally focuses on improving the jawline and the area around the lower cheeks. The incisions are often smaller than a traditional facelift, and the procedure is usually less extensive. That can mean a slightly easier recovery for some patients, and when the mini facelift matches the patient's anatomy, the improvement can be beautiful, subtle, natural, and very rejuvenating. But here's the most important part. A mini facelift has limits. It's not designed to correct significant sagging in the midface. It's not designed to fully address a neck with major laxity, loose skin, or prominent bands, and it's not designed for someone who wants a very dramatic change. Now let's talk about a full facelift. A full facelift is designed to address more advanced facial aging. This is typically for patients who have more noticeable jowling, deeper sagging in the cheeks, more laxity around the jawline, and often changes in the neck. A full facelift is a more comprehensive procedure that repositions the deeper tissues of the face, and it's usually the best option when someone wants a stronger correction and a longer lasting result. One of the biggest misconceptions about a facelift is that it's just pulling the skin tight. A well-done facelift is not a skin tightening procedure, it's a repositioning procedure. We're relifting and restoring the deeper support structures, and then we redrape the skin smoothly without tension. That's what creates a natural look. Now, one of the most common mistakes I see is someone choosing a mini facelift because it sounds easier, and they're hoping it will give them the same result as a full facelift. And I understand why. Everybody wants less downtime, less surgery, smaller scars. But if you choose a mini facelift when you truly need a full facelift, you may not get the improvement you want. And that can be frustrating because you still went through surgery and recovery, but the results feel underwhelming. On the other hand, not everyone needs a full facelift. If you're early in the aging process and your neck still looks good, a mini facelift may be the perfect choice. So the goal is not to do the biggest procedure possible, the goal is to do the right procedure for you. So how do we decide? In consultation, I evaluate a few key things. I look at your jawline definition, I look at the degree of jowling, I look at the position of the cheeks, I assess your skin quality, and I'll always evaluate the neck because the neck is often the area that determines whether a mini facelift is enough or whether we need a more comprehensive plan. I also ask you what your goals are. Some patients want a subtle refresh. Some want to look as young as possible. Some want a long-lasting result. And some want the most natural improvement with minimal changes to their identity. All of those goals are valid. The best plan is the one that matches your goals and your anatomy. Now let's talk briefly about recovery because that's part of the decision as well. With a mini facelift, patients often have swelling and bruising, and most people feel comfortable being seen socially within a couple of weeks. With a full facelift, recovery can be a bit more involved, especially if it includes a neck lift, but in both cases, the result continues to improve over time as swelling settles and the tissues soften. The goal is always a natural healed look, not an obvious surgical look. So here's the takeaway. A mini facelift is best for early aging and mild jowling. A full facelift is best for more advanced sagging and a more comprehensive correction, including the neck. And the right choice isn't based on what sounds easiest. It's based on what will actually give you the result you want in the most natural way. If you're trying to decide between the two, the best next step is a consultation. We'll evaluate your face and neck, talk about your goals, and recommend the option that gives you the most natural, balanced, and beautiful result. So call us at 518-583-4019 or go to SaratogaSpringsPlasticSurgery.com.